Today, let's look at how we can learn to tackle ECG questions on the Nclex like a pro. A nurse admits a client to the telemetry unit and obtains the following ECG. What should be the nurse's interpretation of the strip? Again, you'd want to be conversant with those highlights, those pointers to an abnormality on your ECG. That's the giveaway there. I know my answer would be sinus rhythm with a premature atrial contraction. An unresponsive client is admitted to the emergency room. The client's cardiac rhythm is extremely irregular. Again, extremely irregular. I see no measurable heart rate, no P waves, no QRS complex. And they're asking me what my first action should be. Again, no P wave, no QR. Oh, I'm already thinking defibrillation. Probably this rhythm that we have to deal with. A nurse completes the measurements for the ECG for 4 different clients. Following analysis, the nurse determines that one of these clients requires an immediate intervention. I'm already thinking, which is the most life-threatening? Remember, that's your focus on the Nclex, safety. So I look at all of this rhythm and I'm concerned because I see there's no correlation between P waves and the QRS complexes. I see a very, very slow ventricular rate, which will affect my cardiac output. So this would be most concerning. So we're probably dealing with a complete heart block with this patient. Again, if you're having issues with ECG interpretation, you can join our one-on-one class and we'll teach you those critical thinking skills needed to pass the Nclex. We'll teach you test strategies to tackle prioritization questions on the Nclex. We'll help you find your topic. If you're not able to find your topic on the Nclex, you would not be able to arrive at the correct answers. Again, ECG interpretation would be a walk in the park. Pharmacology dosage calculations would also be a walk in the park. We'll teach you how to apply the decision tree on Nclex styled questions, Nclex priority questions, Nclex evaluation questions. You will have a whole lot of multiple practice quiz. If you're interested in this, you've come to the final bus stop. You've had issues, you've been failing on the Nclex. We are here to help you. We have so many testimonies on people who have made it through the Nclex with our help. You can reach me on the number on your screen. The nurse is supervising a graduate nurse on a telemetry unit. An assigned client develops asystole. I'm already seeing that asystole with no pulse. So that's a giveaway there. So again, they're asking what action by the graduate nurse would cause me to intervene. And I know I don't want to give defibrillator shock with asystole. So that's a giveaway there. A client with dilated cardiomyopathy has a rhythm shown in the exhibit. Which action should the nurse take first? Again, remember with ventricular tachycardias, you are thinking, is my patient stable, unstable? Does he have a pulse or does he not have a pulse? So I know my priority would be to assess the client for a pulse. A nurse is interpreting an ECG rhythm strip for a 2-year-old with heart failure, secondary to a congenital heart defect. In analyzing the rhythm, the nurse notes the measurements, okay? I already see an abnormality there. So that's an abnormality there. And again, I can see the ventricular rate. Although my QT interval is within the normal range for this ventricular rate, my QRS complex also looks within range. So I'm already thinking this client has a sinus rhythm with a 4th degree AV block. Again, not just cramming the pictures of 8 popular ECG rhythms you need to know. The exam is not a content exam. You can go ahead and cram all you want to cram, but if you don't understand the basics behind all of this, then you're going to find it difficult on the Nclex. Once I see this guy, I remember my magnesium. So again, I can write my M here, and that reminds me of my magnesium. I know I have to give magnesium to this client. The nurse is teaching a client with a rhythm above. What's that rhythm there? That's the giveaway. I see that irregularity. I see my normal QRS complexes. I see those fibrillatory waves there. So again, I know this client is going to have to be on anticoagulation therapy, because when you have all those fibrillation going on in the atria, it's going to cause your the blood to pool and it could cause clots to form. That's why we need to place him on that. And option 4 would be our correct answer. Again, you don't need to cram all the ECG pictures. You need to understand the basics behind them. The exam is not a content, it's not a content exam, it's an interpretation and analysis based format. You need to understand all of this. Again, you can reach me on your screen, on the number on your screen. Thank you very much.